The announcement that will nearly double the number of state residents who are eligible for the vaccine. Here to answer your questions about this next milestone is Mary Lou Sudders, the state Secretary of Health and Human Services. Thank you so much for being here with us. We really appreciate your time.
Good evening. I hope you're well. Thank you for having me.
Yes, you as well. So tomorrow morning, we add 1 million more people to the pool for appointments. What makes you confident that the system can handle this?
Well, in terms of demand for vaccine, we say we watch the data. So, we are confident that people will be able to book appointments. We'll put up about 77,000 appointments tomorrow.
Okay.
But, what we're constrained by, of course, is the supply.
Right.
We've also made a number of changes to our website, making it easier for residents to find locations closer to home. Our VaxFinder is much more user-friendly than when we first rolled it out.
What about caregivers for this group? Can they book appointments as well?
No, the caregivers that we rolled out is for individuals 75 years and older only. And it's actually been very successful for those individuals. We're very pleased. And that actually, increased the number of people who over age 75 have been vaccinated. More than 50% of individuals 75 years of age and older have been vaccinated in Massachusetts, which exceeds the national average of about 47%. So we felt comfortable that we could open up to 65 plus and individuals with certain medical conditions.
And to that point, let's talk about these comorbidities for a second. We've gotten a lot of questions about it. How did the state choose which of these conditions should get priority?
Well, Massachusetts took a slightly different path in our prioritization. Unlike many other states, we had 3 objectives. One was obviously to protect our healthcare system. The second was to preserve life. And the third was equity. So we adopted the CDC guidelines on the comorbid conditions that are associated with COVID-19, but we added one more, and that was moderate and severe asthma, because we know that asthma disproportionately impacts communities of color.
Right.
And if you want, I can read the list. I have to read it. Of what are the CDC conditions, medical conditions. So it includes cancer, chronic kidney disease, chronic obstructive pulmonary disease, Down syndrome, heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, obesity, pregnancy, sickle cell disease, smoking, and type 2 diabetes, and then immunocompromised states from organ transplant. So that's the CDC list, which we adapted. And then we added asthma, moderate and severe, because of the impact that asthma has on communities of color, which we know have been disproportionately impacted by COVID anyway.
Right, it's about the equity. Before we let you go, I want to ask you quickly about the variants of this virus. How quickly do you believe they're spreading in Massachusetts right now? And what do you think could happen to the rollout if one of them becomes the dominant strain?
So we've had 29 confirmed cases of variant in Massachusetts. 4 of them were related to travel, and the rest are not. So we believe that the variant has been in the United States. First case was detected in the United States in December, and in Massachusetts it was in January, on January 17th. So the variant is here.
Right.
And I guess what we would say is we know what works. And what works is those very good public health measures that people have heard the governor and others talk about, which is please wear your face covering. Please stay distant from one another. Avoid large gatherings. Avoid gatherings. If you're sick, stay home. And if you're worried, get tested.
Yeah.
So we all need to ensure that we use those really good public health measures, whether the variant is here or not.
Yeah.
And through that, we will work through this pandemic together, and we will get people vaccinated in the Commonwealth of Massachusetts.
All right, Secretary Sudders, thank you so much for your time and your insight tonight. We truly appreciate it.
Thank you. Take care.